accused of being super spreaders, denied play dates, and locked up in the most important developmental stage of their lives. The pandemic's hit kids hard, but a new German study shows they're not the main culprits in passing on the coronavirus. Pediatricians are urging schools and kindergartens to reopen, warning of a lost generation and enormous psychological costs for society. We'll get to the findings of that study I mentioned in a moment when we talk to the specialist behind it. First, calls from children's organizations here in Germany. They want the government to do more to support kids through this crisis.
A real kickabout with friends now feels like a fantasy. For children like 9-year-old Luna, growing up during the pandemic has often meant missing out. The hardest thing is spending days or weeks and months without having much contact to other people and missing them. It's changed my character a bit. I've been lonelier without anyone to do things with. And I've really missed that. Before the pandemic, around 30 children would come to this after-school club in Berlin every day. Now they're making do with one-to-one activities for a couple of hours a week. Some relied on the club for a hot meal. To make sure they don't go hungry, director Bianca Sommerfeld prepares 10 to 20 meals a day for the kids to collect. But most things children need can't be packed up to take home. From an educational perspective, it's the encouragement we give every day that's being lost. That's what's really difficult. At the moment, we can't carry out our everyday work in terms of inspiring the children, showing them new perspectives. The conversations we have here often open up a whole new world for these children. That's not possible right now, and that's really sad.
Ist gerade nicht möglich und das macht uns echt traurig.
The crisis has hit children from poorer families especially hard. 1 in every 5 children in Germany is growing up in or at risk of poverty, with a household income of less than 60% of the national average. They often have less space at home, lack the equipment they need for online learning, and restrictions have made it harder to access support. For children growing up in poverty, this is a very hard year, a lost year when it comes to their education and social development. And they just won't be able to catch up. So it's important that we support these families now and don't wait until the crisis is over. Childhood can't be put on ice. For all children's resilience and adaptability, this period will have long-term consequences.
Johannes Lieser is a specialist in pediatric infectious diseases and joins us from Germany's University Hospital Würzburg. What's your stance on the closure of kindergartens? That's something you've actually investigated.
Yeah, we feel kindergarten should be reopened as soon as possible. Children are not the fire of the epidemic. They are not the major transmitter of the new coronavirus in other age groups. And if they get the virus, they have only uncomplicated upper airway infection.
Can we already rule out, though, that daycare centers and schools are sources of infection?
Yes, I think we can. We have investigated here in Würzburg in 9 child care institutions. We have continuously investigated asymptomatic children who were visiting those daycare institutions in the last autumn and winter. And also we did several thousand swabs and saliva tests. We were not able to identify any major problem with SARS coronavirus infections in these institutions. So definitely we could exclude children who were visiting these institutions as major sources of infection.
Isn't it possible, though, that asymptomatic kids continue to spread the virus over a matter of weeks, if not even longer?
Asymptomatic kids, yes, but they should have the virus. So what we did, we investigated those children who were asymptomatic, and we could not find the virus. So, or only in, a handful of cases among several thousand tests. So I don't think that asymptomatic children contribute to the spreading of the virus in the population.
So just explain to me, what do we know about the disease process in children and parents?
Well, what we know about children is that if they get infected by the new coronavirus, they usually get light upper airway infection without any complications. There are only a very small part of children, mostly like older children, around 10 years, who might have a complicated inflammatory complication, the so-called multi-inflammatory systemic syndrome. But this is an exception, but it is relative specific for the new coronavirus.
So, yes. I was just going to jump in. Based on what you're saying, what would your advice be to parents then who have to work, who want to take their kids to a kindergarten or want to let their kids go on a play date that's been denied them for so long?
Parents should explain their children the general rules which still are effective in the population. Keep distance, wash your hand regularly, avoid those close contacts according to the regulations, because we cannot, because we have to see the family as a, as a whole group, and not, we cannot make any exceptions for, smaller children in the family, older children. It would be too complicated. It's better to keep one clear recommendations for all.
But you want to keep it simple. The fact is, though, we've got a whole generation of kids growing up here in a very different environment. What about the psychological effects on these kids?
The psychological effects should not be underestimated. If children do not have regular contacts to their age-related peers, to their institution like childcare institution, kindergarten, and primary school, they certainly miss an important piece, which is important for their neurological development too. And that is what we as pediatricians fear. And therefore, of course, we hope that the childcare institution can be open soon. And as I said before, I don't see a problem in this, because in the childcare institutions, there is no major infectious disease activity by the new coronavirus so far.
Okay, thank you very much for talking to us. Johannes Liese, University Hospital Würzburg Department of Pediatrics.
Thank you.
For the last time this week, it's over to our science correspondent, Derek Williams. He's been fielding your questions on our YouTube channel.
If you've already had COVID-19, do you still need to be vaccinated?
Yes, healthcare authorities recommend that you do, assuming, of course, that you've completed your isolation period and are symptom-free. But that blanket advice is also evolving and growing more specific as we move forward with vaccinating growing numbers of people. For example, a number of studies have indicated that naturally acquired immunity in nearly everyone who had the disease really is effective for at least several months. We expected that, but it's still reassuring to have the assumption backed up by evidence. During that period, reinfection appears to be very rare. So if you've had COVID-19 recently, it almost certainly won't hurt to wait a while for the vaccine, the experts say. And that will increase access to vaccines for people who haven't had the disease during this critical stage of the pandemic with vaccine production still low. And other factors could also influence future advice. For example, in a recent study looking at this topic that's still awaiting peer review, the authors found that after a single dose with a vaccine, people who'd already had COVID-19 had antibody responses that were often more powerful than what 2 doses caused in people who'd never had the disease. And that powerful immune response to a single shot was accompanied by more heavy-duty side effects like fatigue and fever and headaches as well, which in people who've never had the disease usually come after the second shot. So a debate has begun on whether it might make sense for those who've had COVID-19 to be dosed only once, which would also free up more vaccine for people who haven't had the disease. But at this point, with data still limited, a lot of experts say it's really better to err on the side of caution and stick to the 2-dose regime used in the trials for everyone until we know more.